Speaking Books is a new training tool that has been developed to make health education more accessible to low literacy communities. These books, produced in various languages, effectively impart crucial healthcare messages to rural citizens, people with low literacy skills, and patients too sick to read, as well as children. Research has shown that when information is presented in both visual and audio form, knowledge gain is increased by over 50%. Speaking books simply and comprehensively explain complex health issues to low literacy communities. In South Africa, 30% of adults are illiterate and 16% of the population have had no schooling at all. These hard-covered books are durable and full of colorful illustrations. By pressing one of the 16 buttons, the listener can activate a 30-second recording that follows the text of each page in the book. The books cover a spectrum of social and health issues including TB, HIV and AIDS, depression, malaria, suicide prevention, and how to obtain a government grant.
This is Rosie Modena from Generations, welcoming you to Speaking Books. If you or a loved one have had a positive diagnosis of HIV/AIDS, it is normal to feel worried, angry, blame yourself, feel guilty or afraid. You may feel despair and sadness and worry about how to tell your partner or family.
If Rosie Modena is speaking about it, first of all, it's acceptable, so they no longer have to feel ashamed about having depression. And now they want to read it because Rosie Modena is speaking about it, so it makes them want to listen. This book has made explaining it quite easy.
Distribution of this innovative educational tool to trainers, lay counselors, teachers, faith-based organizations, and community caregivers allow the Speaking Books to reach every corner of the community in need. Each book is shown to over 27 people, influencing and educating many users. In rural communities in particular, where literacy skills are limited and access to other educational aids is restricted, the Speaking Books provide an effective tool to empower those communities to fight stigma and gain knowledge and insight into critical healthcare issues.
The book is superb, it's excellent. Actually, it's going to reach the community because it's got all the languages where even if you are a vendor or Sotho, you can understand. It's not like it's only English.
So now I know about the depression.
They are very easy to use because we have got pictures and we've got a voice. They are going together.
It's going to help our patients to learn more.
Southern Africa faces an ever-deepening health crisis with an increase in the number of people suffering from HIV and AIDS, TB and malaria, and a critical shortage of hospitals, clinics and trained medical staff. People with low levels of literacy are particularly vulnerable, as in rural areas, services are usually poor and people in need of vital healthcare information are often unable to access it. Speaking Books empower patients to take responsibility for their own health, teach them the importance of medication compliance, and provide hope to the hopeless. Speaking Books allow patients the opportunity to learn about their illnesses in their own homes and spread the word among their families and friends. A major concern in South Africa is the increase in teenage suicides. Speaking Books are also used extensively to assist in the education of children in suicide prevention and safe sex practices. The books encourage interaction and have become exceptionally popular among school learners, making them effective education tools in the absence of educational psychologists and life skills teachers. The Speaking Books have been endorsed and supported by the South African government's Departments of Social Development, Health and Education, as well as by leading corporates and pharmaceuticals, and via a number of international grants. At a cost of under $10 each, the books are always distributed free of charge to the communities who need them. The concept is now being replicated for many parts of Africa, Europe, Asia and the Americas with the introduction of Swahili, Portuguese, Spanish, French and Mandarin versions.
When we have this book, they learn because we leave the books in the house. Yes, my patient liked this book
very, very much because they changed their lives.
Teach me about the death certificate. I know I have lost my mother and my father. I read this book and it helped me to get that death certificate, and I can apply for a grant, and in other hands it helped me at the school.
The key to the success of the books is that the information is seen, read, heard, and understood with powerful and effective results. The speaking books are a world first, created by South Africans for South Africans and subsequently other low literacy communities around the world.